The Mid-South is known as the mecca for lung cancer cases. Unfortunately, no other area in this country has more people diagnosed with this terrible disease. Our Brittany Moncrief is here now with why that's one reason Memphis is at the forefront of a new test for treating lung cancer.
That's right, Richard. It's called biomarker testing, and it has transformed just about everything. Doctors say 10 years ago, only 4 out of 100 people diagnosed with advanced lung cancer survived longer than 5 years. But now, with this new testing, 60 out of 100 survive.
When you talk about Gina and bravery, going into brain surgery and smiling, going into lung surgery.
Bravery beats all odds.
I think bravery is just not knowing what you're getting into, but going for it anyway.
And Gina Hollenbeck stepped into it boldly.
Gina was full of life. If you saw her, it would brighten your day. And God.
Greg is Gina's husband and was right by her side as she battled stage 4 lung cancer.
When Gina was diagnosed in 2016, they gave her about 7 to 10 months to live down at MD Anderson.
Time neither Gina or Greg accepted.
We just started researching and we found out about these different biomarkers.
So they turned to Baptist doctor Raymond Osaragambon.
A biomarker is a test that you use to find the presence of a condition or to predict its future behavior.
From the biomarker test, Dr. Osaragambon was able to determine how Gina's cancer cells would behave and what medication would respond best, buying Gina time, which she reflects on in this 2018 video.
And sometimes I would just fall to my knees in tears just because I couldn't believe that this was the outcome, because it's not supposed to be this way.
Instead of her living 7 to 10 months, she got almost 7 years.
Gina passed away June this year. How would you describe those 7 years?
Valuable.
On the one hand, there is the stepping back and saying she lived more than 6 years. On the other hand, there's a stepping back to say, look, a young mother of 2 lived 6 years. That's not nearly good enough.
So Greg, alongside Baptist, started the Gina Hollenbeck Memorial Fund, raising money for biomarker testing for those who can't afford it.
A large part of the problem is the doctor doesn't know to do the test, and the patient doesn't know to ask for the test.
And insurance doesn't usually cover it.
What we're trying to do with this fund is to figure out pragmatic solutions to the problem, to make sure that nobody gets left behind.
I just feel honored that I can actually do something.
An honor that carries on Gina's bravery. And Gina was a huge advocate for lung cancer patients globally. It's only fitting that this Giving Tuesday, the Gina Hollenbeck Memorial Fund is up and running.